introduce yourself and tell us how long you've been doing massage therapy for?
My name is Sarah, and I've been a massage therapist for almost a year.
And what's your favorite way to unwind after a full day of treatments?
The first thing has to be food. You have to start with food. And then, depending on how tired I am, maybe some Wii Fit with my significant other. Gets a little bit competitive sometimes. And then maybe finish the day with rolling out with a foam roller, and then maybe some TV, something relaxing.
What made you decide to become a massage therapist?
So growing up, I had a parent that did Reiki, so massage was kind of something that it's always been around. And having learned from him at a very young age, I was always that kid that if anyone around me said, "Oh, like my shoulders are tight, my legs hurt," I'd be like, "Oh, let me massage it for you." But it wasn't until a couple years ago when I was working on my sister's now husband, who has a condition that has put him in a wheelchair since childhood. With this condition, he has a lot of spasticity in his muscles, so he's in pain a lot. So I told him I would give it a shot, and I ended up being able to help him open his hands for the first time in 5 years, and so that told me that maybe I should do some education and have it as a career because I enjoyed it.
Been practicing for about a year. What surprised you the most about the job?
I'm not sure if there's anything that I found particularly surprising, just based on the education I had at MacEwan. They really prepared us for what it would be to work as a massage therapist, just with how many hours of clinic practice we had. So far, nothing too surprising.
What's your current favorite show, podcast, or comfort series?
I've been really into watching The Man Tracker lately. It's a show from the early 2000s, and it's very interesting.
What's been the biggest learning curve so far in your career?
The biggest learning curve has definitely been the softwares and learning how to use different softwares, apply to insurances, the billing, everything, which can be a little bit overwhelming at times. That's definitely been the most challenging.
Coffee, tea, or matcha?
I don't drink coffee. I've never had matcha, so tea would definitely be my answer, preferably a chai.
What's something cool or fascinating you've learned about the body?
I think the most fascinating thing I've learned so far is that there's a fascial connection between hip flexors and your diaphragm. So if there's some kind of dysfunction with one of them, the other one will also be affected.
Are you more structured in your treatments, or do you go with the flow?
I'd say a little bit of both. I like to do a very thorough assessment going into a treatment, so I'll have a general idea of what I want to do. However, I kind of see how the body responds, and it might change, and I kind of go with the flow after that.
What's one moment so far in your career that made you think, yes, this is why I do this?
I had a client come in that had tingling and numbness after sleeping weird one night. And after doing an assessment, I found out that one of his first ribs was elevated, and I was able to treat that. And since then, he's had no numbness and no tingling.
As you continue growing as a therapist, what kind of experience do you want clients to have in your room?
I want them to leave the treatment room feeling better than when they came in and have a better idea of how they should be taking care of their body with a better understanding of what's going on.